Hey y'all, hey, it's your girl Dr. Kiiyonna Jones, aka Sidepreneur Nurse, and I wanted to shoot a quick little video. This is a question that I got asked, and I think it will be one that will be extremely helpful for those who are interested in starting your own aesthetic, wellness, and or med spa. And that question is this something that I can actually do on the side? And I find that a lot of people who are successful at launching these type of businesses on the side are usually the ones who have limited resources and people who are starting from scratch with limited business background. So today I am going to talk to you about how to launch your own aesthetic slash wellness slash possible med spa and do this on the side. Welcome to my channel, you guys. I am always excited to come and bring value because I know that this could help someone get closer to their dream of financial freedom, of time freedom, and also venturing into an aspect or an area of healthcare that's more enjoyable, let me just say. So here's the thing, a lot of people will disagree with me, which is okay, but I have helped hundreds of nurses, nurse practitioners, and physicians launch their aesthetic practices, med spas, on the side and do it successfully. And I want to give you guys 5 tips on how you can do the same. Today, I'm really going to try to keep it under 10 minutes. If you find this video valuable and this is able to help you in some capacity, hit that subscribe button and that little bell button so you'll be notified every time I roll out these videos. I want to remind y'all that I am a full-time entrepreneur and I usually have a heavy load of patients. So I am coming on here to do this to really help those who are where I was 7 years ago enter into this space. All right, y'all, so let's get started. So if you are looking to start this business on the side, there's no reason to rent a location monthly when there are opportunities out there where you can actually co-lease. Now, here's the tea. What I found out is that since 2022, there has been a lot of people who have had to go back to work. Some people were thriving, as entrepreneurs, and for some reason, they've had to go back to work. And a lot of those people, especially since they were entrepreneurs, were renting out suites. So if you are one who really wants to go to a suite and rent that for your practice, contact the owners of these locations and see if they have tenants who are looking to co-lease. This is a great opportunity for you to be able to not spend as much of your financial resources on your location, but rather going in together with someone who already has the spot. Super easy to do. A lot of times the owner actually supports it because they just want to make sure that their lease is paid every single month. So it's kind of a win-win situation. Another thing you can do is you can go on a site called loop.net. Loop.net is more, you can find medical office buildings. So they're not as pretty as the Sola Salon and the Phoenix salons of the world, but they are office buildings. They are clean. They usually have a lot of parking and they're just an overall clean location. So you can do something like that and you will find that you will pay a fraction of the cost that people pay when they are renting the high-end suites. Another thing is I am creating this video under the assumption that you understand you need to get the correct corporation for your state. You also have a medical director, of course, and you have your actual corporation filed, and that you even have decided on what treatments that you're going to offer. Now, the second thing, if you're a nurse or a nurse practitioner, focus on treatments that does not have a huge learning curve for you. An example of that would be GLP-1s. They are great treatments, the semaglutides, Ozempic, of the world. And what's good about it is you as a practitioner or a nurse, all you have to do is learn about this medication, make sure that you really understand, because it's not just a matter of giving it. You have to be an educated provider or practitioner in this space. I say offer one, no more than 2, especially if you're doing it on the side. You want to become an expert in a couple of treatments and become the person who's known for it, all right? So start small, a GLP-1, or offer something like IV hydration or, injectables, as far as vitamin injectables, something that doesn't require you to learn a new skill per se. All right. So that's number 2. The third thing I want you guys to know, when you are starting your business on the side, you need to have a way that you can project your revenue. Like, how many clients do you need to see within a week to achieve your financial goals for your practice? All right. One of the things that I offer in my mentorship is a revenue projection template. So for those it is specifically for solopreneurs and solo practitioners in the aesthetic space who only have a few hours to dedicate to their practice every single week. So when you have something like a revenue projection template, you will be able to predict how many clients you need to get inside your location in your chair to receive these treatments, and how much profit will you make off of that. And that way, if you only have 10 hours for the week to dedicate to your side business, you can actually project, okay, if I get 5 people in here this week, what is that financial picture going to look like for my business? And how does that look if I get 5 clients every single week, right? So you're going to have to be really, really careful of your time and really monitor it and treat it like a business. Like, you have to make sure that if those are the hours you have available, commit to that, show up for that, and always be either working in the business during those hours or working on the business during those hours. Another thing that is extremely important, you guys, when you are starting your business on the side, is to make sure you have some type of efficient marketing plan, okay? It needs to be a strategy in place so that you are kind of double dipping, if you will. So getting yourself really programmed to be able to create content while you're also treating patients, I will say it's a high skill. So essentially what I do in my practice is, let's say I have my patients sign their consents, whatever the paperwork that's relative to the treatment. Within that, I say I have a form that allows them to give me permission to record or to show the actual procedures that I'm doing. Now, they have every right to say, no, I'm not interested. I don't want to give you a testimony. I don't want you recording. That's totally fine. And then I could be teaching them or educating them, or even if I'm performing a procedure, I won't show the patient at all or any identifying information, but it'll be on me as I am performing the procedure on them. That is a good way to get additional content and not you actually having to create the content, because it really can be a headache, you guys, creating content, trying to actually have the time to take care of your patients and you have a full-time job. Like, you really, really have to be mindful of that. And then the 5th thing I'm gonna give you guys is you have to make sure you have some type of operational systems in place. What do I mean when I say operational system? You should not be communicating back and forth with patients to schedule a time for them to book. You should not be going back and forth with patients regarding what kind of treatments they're gonna get over your phone, okay? And what I mean when I say that is that takes a lot of time for you not focused on either your skill or your craft, or being present in your practice and or working on the business, okay, and not in it. So when you're working in it, you are performing the treatments or services, but when you're working on it, you're on the back end, continuing to grow it, making sure that your business is moving in the direction that you plan for it to go. Now, the reason why I am elaborating on this, because with the limited time you have, you need to have your systems and your automations doing the heavy lifting for you. All right. I'll give you guys an example. One of my systems that I have in place is I have a landing page, but I have ways to collect my leads through the landing page. When someone signs up for a consultation with me, I have automations where they automatically get the consent. They automatically get the virtual link if it's a telehealth consult. They automatically get that via email. Once they have decided to book their appointment, that is handled all from my automated system. I do not do any of that. If I had to communicate with every single patient and text back and forth with them or email them back and forth regarding their appointment, I would not get anything done. So you need to think about, when you're going to launch this type of business, especially on the side, how can I automate? How can I even lean into AI and all the tools that are out here so that my business can run operationally without me when a client wants to come in for an appointment? All right, so you guys, those are 5 things, 5 little pieces of nuggets that I just dropped for you on how you can start this business on the side. This is under with the assumption that you know how to actually start a med spa. If you don't, I have a video that tells you exactly how to start a med spa from the corporation level, like making sure that you're compliant and you're meeting regulations. My video already tells you that, so make sure you go back and watch it. Again, you guys, if you found value in this video, go ahead and hit that subscribe button and that notification button so that you'll be notified when I release these videos. You guys, most of the time when I come, I'm extremely exhausted, I'm tired, but I am here because I want to continue to serve and help others who are like I was launch their own aesthetic business. All right, you guys, until next time, take care. Bye.